Welcome to Infertility and Me podcast, a show that amplifies diverse stories about the struggles of infertility and fertility in a safe space. Our goal is to normalize fertility stories that validate, give hope, and create a community where no one is left silently suffering. Welcome back, friends, to another episode of Infertility and Me podcast. Appreciate you for being here. If this is your first time, my name is Monique. I am an IVF mom to one, serial entrepreneur, and as you can tell, a digital creator and women's health advocate. So I appreciate you, friends, for tuning in to another episode. And today we have Dr. K. Duga from Instagram. It's where I know her. She is a board certified naturopathic physician, and she's been in the industry for over 15 years, beginning as a nurse, if I'm correct, Dr. Duga. Is that right?
Yes, that's correct.
Yeah, so I appreciate you, Dr. Duga, for being here and speaking to us today and just sharing space with us.
Thank you for having me. I'm so happy to be here. I've been following your work for a little while in the background, and I knew there would be a time where we would come together and collaborate because I think any woman who is an advocate for Black women's health, like I am, is just bound to come together and have a conversation. So I'm really excited about the
Yes,
conversation today.
absolutely. It's my pleasure to host you and to have you. And I'm sure our friends listening or watching on the Tizube will be appreciative too of our conversation today. Um, let's see, where should we even start? So you got into naturopathic medicine after becoming a nurse. Was it because of your own experience with fertility problems or issues at some point?
No, it was actually unrelated to fertility. I didn't even know I was going to end up here, to be honest. So I became a nurse back in 2007. But when I was growing up, I was always, pushed to become a doctor. And I actually started my path towards becoming a doctor when I was in high school. I was in the medical magnet program in high school, and I would go to the hospitals and kind of learn about the different specialties within medicine, right? And the more and more I did that, the more and more I became passionate about helping people be
Mm-hmm.
healthy. You know what I'm saying? And so, when I went to college, I went to University of Miami pre-medicine program. My major was chemistry because I
Okay.
was in a pre-med track, and then somewhere along the way, something happened with my family, and I decided to kind of switch gears and get into a career where I could make some money right after
Mm-hmm.
graduation. So just to be honest, right? And so I switched to nursing, and then the plan was to do nursing for a year max two, and then go back into my pre-med track. Girl, I was working in the ER at the largest teaching
Mm-hmm.
hospital in South Florida. It's
Yeah, I've
called
heard of it.
Jackson Memorial Hospital.
Yeah, because I
And
have an uncle who
okay, so
went
you
to
know about
school
Jackson. So it's
at FAMU, and he never came back up north. He stayed there, and so he's told me about all the various areas that
oh,
we
okay.
over the years been out there a lot of times. So yeah, I have heard of that facility. Yes, and that hospital. Yeah.
Yeah. Jackson is like in the smack of downtown Overtown, which is like the
Mm-hmm.
hood of Miami, right? And so it's a large teaching hospital. It's a hospital that serves mainly the underserved, right? And so I was serving the underserved, meaning poor Black people. And I did not like
Mm-hmm.
the medical system. I was like, this doesn't vibe with me. And the reason why I say that is because I was noticing that there were so many gaps. One gap was if people wanted to get off blood pressure medication or diabetic medication, there was no guidance on how to do that. There was no guidance on how to get healthier, how to optimize health, that there was just no conversation around that. It was very disease focused. And growing up, I was always about health. And here I was, and it was all about disease. And I'm like, how do we help people get, healthier? And so throughout the years, I would have conversations with my patients. As a nurse, you are an advocate for your patient, right? And so my patients would feel very open to have these conversations with me that they weren't really open about having with their doctors, right? Because doctors would be in and out, and that was it. And I would be the one, providing the actual care. And so they would be like, how do I get off this blood pressure medication? How do I lose this weight? How do I? And then I would start to educate them. And I would notice that the ones that I took the time to educate had better health outcomes, right? And so, long story short, I decided to leave. I decided, all right, I want to go a different route. I want to go down a route where it's about health promotion. It's about lifestyle. It's about fitness. It's about thriving. And so I made the shift, and I left the medical world, the conventional medical world, and went to naturopathic medical school in 2012. And then after I graduated naturopathic medical school, I've since become one of the very few medically trained and naturally focused specialists. And in the first year of practice, I was seeing general things. And then I was like, I want to specialize. And then at that time, I had a really close girlfriend of mine who was dealing with infertility. She had decided that she was going to go the single mom by choice IUI IVF route, because she was ready to have a baby and she didn't have a partner. And I just saw how depressed she was, how I just saw what it did to her. And this is like my close girlfriend. I'm getting chills just talking about it, because I haven't really talked about it. Just seeing what she was going through and me not being able to help her, right? Growing up, I've always been that girl that my girlfriends would call when there was a health crisis, always. And this was a situation where I could not help her, right? And at that same time, I was like, I need to specialize in something. And so that, coupled with the fact that I was getting older and I was becoming curious about what it was going to be like for me when I did decide to have children. Were my children going to be healthy? Was I going to have difficulty getting pregnant? All of these thoughts were swarming through my mind around this time. So I was like, all right, if I'm looking to specialize, let me look into fertility. Let me do some research, some market research.
It's a lot. It's a lot.
Girl, what I found.
It's a lot. Yeah, it's a shit show for sure.
I remember emailing my mentor. I was like, there's so much here. Oh my God, there's so much here. And the very first piece that I had to tease out was this term infertility. It got to me because I didn't understand why women who had children before naturally with no problem, going for their second one, were being labeled as infertile. Like, I just didn't get it. I was like, wait, how does a woman who already have kids have this infertility label on her? Like, I just didn't understand.
That unexplained infertility and secondary infertility, especially secondary, it's very, very
then I
tricky waters, real tricky waters.
Right. And so here I am, I have a full-on medical degree, and I was confused, right? And I was like, I can't imagine how confused the women who are going through are, right? And so fast forward. So this is the beginning of my, tiptoeing into the fertility world. I start producing content around fertility, and a friend of mine who used to work with me when I was an ER nurse reached out to me. She said, hey, I love the content that you're sharing about fertility. I just started a show. Would you mind coming on and being part of the show? But here's what I want you to talk about. She's like, my girlfriends and I have been talking, and her and her girlfriends don't have any children. She said, my girlfriends and I have been talking, and the conversation always comes back to this. Am I going to die when I give birth?
That's chills right there. Yeah.
Am I going to die? The fear of dying is very real for them. And she said, would you mind coming onto the show and talking about Black maternal mortality rates? I paused because it's a very heavy topic. And at that time, I was like, I don't know how to bring heavy topics like that to the forefront without bringing the whole energy down, and also without providing a solution. I don't like talking about dire statistics without proposing a solution, because what are you leaving people with, right? And so I was like, I don't know why I said yes. I said yes, right? So I started doing research for this conversation. In the conversation, what started to come up for me was the fact that when I was sitting through nursing lectures, when I was sitting through my medical lectures, there would always be that one lecture where they'll talk about Black women are 3 to 4 times more likely to have this disease more than white women. I mean, you name the disease and we were 3 to 4 times more likely to have it. And they would just sort of move on past the stat like it was nothing. And when they stated that Black women were 3 to 4 times more likely to die giving birth, and just move past it with no explanation as to what was going on, I said, wait. I was like, in that Kevin Hart voice, wait a minute, wait a minute. You're not going to just speed past that like you didn't just say what you just said, right? But they would just speed past it, right? And so when I was preparing for this conversation with her, for this interview with her, I said, I'm going to get to the bottom of this. I'm going to figure out what's going on. I came across the work of Dr. Jenny Douglas, whose lecture started off with this quote: "Black don't crack is a myth. It does crack, and it's cracking." And she talked about the concept of weathering. Have you heard of the concept of weathering before? Okay. Weathering is a phenomenon that was coined by this white woman. Her name is Dr. Arlene Geronimus. I may be mispronouncing her last name, but she's a researcher out of Harvard. I came across this lady's article, and this lady is talking about her research in racial health disparities, how she started following these Black teenage girls just to understand why Black girls and also Black women had greater health issues in comparison to the counterparts, right? And basically what she termed was this term weathering. It's when racial stress, the everyday racism, microaggressions that we have to deal with as a Black woman, has a physiological effect on our health, to the point where they are finding that we are aging earlier, right? And so in Black culture, we have this saying that Black don't crack, right? Because, we could be 50 but look 40, right? But here I was deep into the research that was saying that actually the opposite is true, that there is a phenomenon that's causing Black women to actually age earlier. Now, what does that mean in terms of reproductive health and infertility? What that means is that our biological clocks as a collective is accelerated. So a Black woman could be 30 years old chronologically, but 35 years old biologically. See what I'm saying? I'm going to say that again. We could be 30 years old biologically, but 35 years old reproductively, right? And so when I saw that, I said, this makes sense, because I kept getting Black women who were coming to me and who were saying, I don't even qualify for IVF because my AMH is too low. Now, I know you know these terms. We can get down to the nitty-gritty. My AMH is too low. I don't even qualify, right? They're saying I have premature ovarian insufficiency or premature ovarian failure. So what I want your readers to understand is that what is happening at the deepest level when it comes to Black women's fertility is this concept of weathering. That is chronic stress that is turned on constantly, that is causing earlier breakdown of our organs. That is what is at the root of it all, right? And so the second piece to that is that the term infertility itself one, doesn't
No.
explain the root cause. Like the term infertility doesn't tell you that that's what's going on. And also the term infertility unfairly labels women, because the stats are showing that only 3% of the world's population is truly infertile, meaning they can't get pregnant no matter what. Only 3% of the world's population is truly infertile. So that means even if you've gotten the diagnosis of infertility, you're still more likely to be fertile than infertile, right? So what we're really dealing with is is what I call subfertility. It's lower fertility due to an underlying health
So
problem.
would
Does that
that
make
be
sense?
along the same lines as environmental factors such as the metals that are in our water supplies and our food, the chemicals from the pesticides, all those environmental things that we are experiencing that we didn't experience, or our grandmothers and great grandmothers didn't experience 50 or so years ago, maybe even 40 years ago. But by that time, I think in the 70s, in the 80s, we were being exposed to a lot of these things through the cookware. I've read research about that and watched documentaries about the cookware and how the metals and such like that. So would that be along the same lines as that, the sub infertility that you speak of? Okay. Okay.
Correct. That's exactly correct. So when I'm talking about like common root causes of
Mm-hmm.
subfertility, not infertility, I also get into what infertility actually means. So there are a few. So
Mm-hmm.
there's the chronic stress. There is the environmental factors, the environmental
Mm-hmm.
toxins that you're talking about. There is trauma, right? There's
Sure.
nutritional
Sure.
deficiencies, right? But none of
Of
those, in
course.
hormonal imbalances and gut dysfunction. But none of those things are separate. They're all related. It starts with the chronic stress picture, because when you have ongoing stress, what it starts to do is it down regulates or shuts down your hormonal system, your detoxification system, your digestive system. So if your chronic stress is shutting down your detoxification systems, that means when you come across this toxic environment that we are now living in, as you pointed out, your body can't even clear that out.
Mm-hmm. Mm-hmm. No, I get it,
You
because
see
I
what I'm
remember
saying?
reading about a lot of these things before getting my diagnosis and even after getting it, and trying to optimize my health physically to house this child. Because what good would it be if I go through IVF if I'm not taking the necessary steps to make sure that I can at least carry the baby, or for the embryo, not the embryo, but the egg to implant, the embryo to implant, all those things. So I definitely get it, and it's not woo woo as it seems, or like people make it out to be. No, not at
Okay.
all. These things do play
Yeah.
a pivotal part
Yeah.
in our fertility, and a lot of people in the community, they do speak about it. They don't always like to, especially when they have conditions like PCOS and endometriosis, which are also subsets of infertility, like you're speaking of, when you think about it, because estrogen dominance, and then PCOS being genetically passed on. It's so many layers to our health, our bodies, and
Mm-hmm.
infertility or fertility issues as a general umbrella of things. There's a lot of different factors that play into us not being able to get pregnant. Yeah.
To get pregnant. It is a lot of factors, but I like to let me try to simplify it for everyone, because when you say like PCOS, fibroids, in the conventional world, those things are
Mm-hmm.
treated as separate, but in
Okay.
my world, they're not. They come from the chronic stress.
Mm-hmm.
So you and I, we express our symptoms differently. We express our
Sure.
imbalances differently, right? So you and I could be in the same exact environment, right? And then one of us could have our fertility be affected by the environment, and the next person not, right? That is the individuality in genetic expression, right? And so the same way that can happen, the same way that, you know, when I'm exposed to environmental toxins, the way that it affects my fertility could be via PCOS versus fibroids for another woman, right? But it's coming from like the similar root. And so what I have found is, because chronic stress is at the root of it, I've come to sort of come up with a new umbrella that I term reproductive metabolic dysfunction. Because when it gets down to it, it comes down to what is happening at the cellular level, right? And so chronic stress, the reason why I keep emphasizing it for Black women is, not only is, so the environmental toxins that you talk about, it's like that's what everyone is dealing with. White women, Asian women, Black women, everyone is dealing with that, right? But what separates us from the other groups is the racial stress. We have that on top of racial stress. You see what I'm saying? And so I think that's that nuanced piece that keeps getting missed when it comes to the infertility conversation. When it comes to Black women, is like, we're nuanced. We need a different approach because we're Black. Literally, you look into research, it'll tell you Black is a risk factor.
Literally, yeah, for sure.
It's literally a risk factor. Not because something is wrong with us inherently as Black women, but because something is wrong with the society that we live in that treats us differently because we are Black.
Absolutely.
You see what I'm saying? On the day-to-day, right? This is not something that we can just, I mean, I guess if you move to a different country, right, you can, get away from it. But like, this is day-to-day, and chronic stress is day-to-day. So there's normal stress that gets turned on and then it gets turned off. That's a normal stress response. It gets turned on and it gets turned off. The chronic stress picture, it doesn't.
That's why it's called
off.
Chronic, right?
It stays. That's why it's chronic. It doesn't turn off. And so when it doesn't turn off, guess what happens? It robs your fertility system of the resources and the nutrients that it needs for good ovulation, for good egg quality, for a pregnancy that sticks, for a healthy baby, for a healthy pregnancy, for a healthy postpartum. You see? And so it's like, we can't skip this racial chronic stress thing. No one is talking about it, but it is at the crux of everything.
I understand. Yeah,
right?
I got you. I'm on the same page. I understand exactly where you're coming from. And I do agree that when you're dealing with racism in any capacity, it affects every aspect of your life. It affects how you view yourself. It affects how you see yourself, how you present yourself. Code switching, as we like to say in Black and Brown communities, code switching is a thing. All those things that contribute to us being able to live as peacefully as we can in this society that really wasn't created for us to live like we do, right? Here in the United States and in many other colonized countries and continents. And so that's very interesting. And although I've talked about racism in the fertility community before, because I experienced medical racial biases a lot of times throughout my adult life. And then also specifically the first doctor that I ever went to who originally diagnosed me. And I got through it, and she wasn't disrespectful, but I could tell that the way that her and her staff approached me and how they approached everyone else was different. They would literally greet people differently. And so what that led to, what happened when I experienced that racial bias in a fertility clinic, it scared me away from fertility doctors for 4.5 years and getting more testing done. And so that goes right in alignment with what you're speaking of, because when we are going and seeking some help for our bodies, the very thing that gives us life besides our soul, right? And we're having this human experience. And when you're going to get help from someone and you can feel what's happening, it turns you off. And this is why in our community, We are sicker than
Mm-hmm.
everyone else because these things happen. We get turned off and we don't go back until it gets real bad, until we have to have partial and full hysterectomies, until we have to be cut open and pried open and all these other things. So, yeah, I've been there. I have been there.
Oh my gosh. I'm as you were talking, I was thinking about one of the stats that I came across
Okay.
when I was doing my research about fertility. And this was on the Fertility for Color Girls website. And it said that the number one barrier to Black women getting fertility treatment is
Yeah.
silence. Silence, waiting way too long to get help. And so as you were talking, I was like, of course it would that would be the case if we are dealing with the medical system that treats us differently.
Mm-hmm.
Like, why
Mm-hmm.
would you want to go back? Why would you
Mm-hmm.
don't even feel safe. There's no safety, there's no trust. So why would you seek help in that system when that is seemingly your only option? So of course you're going to
Mm-hmm.
suffer in silence. Not to mention the shame of the infertility diagnosis, right? Like, Black women are supposed to be hyperfertile. How dare you
Listen,
be
our
infertile,
grandmothers were
right? Like,
having 7 and plus babies easy into their 40s. My grandmother on my paternal side, she was born in 1915 and she had her last baby at 45. So you know what I mean? So yeah, and then that was the basis for the podcast and the platform, is to end the silent suffering, because after that experience, I never went back to the doctor for 4.5 more years. And it took me a very long time and a lot of inner work to go back and to see if anything changed, because they were saying that I had a blocked fallopian tube at the time, the first time and such. And so it was just all these different things and nuances, like you say, that Black women and other women of color also deal with, because I've spoken to other women of color and they've had similar experiences. And I'm talking about even what they would call the model minority, being like our South Asian and Middle Eastern brothers and sisters, and they supposedly get treated better than we do, and they do it a lot of times, but for some reason in the medical system they experience a lot of the same things that we do, but they're not dying as rapidly as Black women do, and or staying as sick as we do. Unfortunately, it seems that we are always um, we are the basis of a lot of medicine as we know it, but at the same time nobody is doing anything to fix the issues. But we literally, our bodies were literally used as the basis for medicine in American society as we know it.
they
Exactly.
practice on us. Yeah, they practice the
Mm-hmm. Mm-hmm.
my mind is going blank. The little instrument they used to do the
Yeah.
pap smears. I should know
No,
this.
it's
I'm a
fine.
doctor, right?
It's
But my
fine.
mind is
Yeah.
going blank.
It's
That was invented from experimenting on
mm-hmm.
Black women's bodies. The guy that they
Mm-hmm.
call father of medicine came up with all of those gynecological devices from
Mm-hmm.
practicing on Black women. And so there is real bias in the medical system that we have to deal with when we interface with them, right? There just is.
Mm-hmm.
Those are just facts. And I would say it's like, because that's a given, like, I would admonish your listeners to not allow that to keep them from getting the
You
help that
deserve
they
it. Yeah.
deserve. We deserve good care. We deserve high
Mm-hmm.
quality care.
Mm-hmm.
We deserve it. We're entitled to it. You have to be able to push through. I won't even say, I'm not even gonna say push through. Find somebody
Mm-hmm.
else. You know what I'm saying? Like, find
Mm-hmm.
somebody else who you mesh with. You don't have to deal with doctors who treat you differently. In this day and age, you can easily report
Yeah.
somebody. Like, speak out,
Mm-hmm.
speak up. Don't be silent about it. Keep them accountable. These physicians are supposed to be the carriers of knowledge, the caregivers. So if you don't feel like you're getting good care,
Mm-hmm.
go somewhere else.
Mm-hmm. Absolutely.
You don't have to deal with it. Speak up,
Yeah.
speak out, say something. You know what I'm saying? The other piece too is as you were talking, can you speak more to like what the
So
treatment
yeah.
was? I'm sure you probably talked about it in your other
Yeah.
um,
No, it's been a while
episodes,
since I talked about it. Yeah.
but I just
Oh
want
no,
to,
no, not at
know
all.
if you
It's been
don't
a
mind
while since I've talked
sharing.
about it. It's probably been, yeah, it's been a while. So what happened was I was 29, and it was about 5 or 6 months after I turned 29 in 2012. My birthday's in October, so we would have been moving into, no, it wasn't even that long because it was still cold and I had on a coat or a jacket or something. So it was in 2012. I was It was early 2012, maybe close to spring. I had just turned 29 in October, and I was living in Pennsylvania. And the area where I lived, it was predominantly Caucasian. And as we know as well, that infertility, going to see fertility specialists has always been deemed like a Caucasian woman's issue or a rich woman's way of getting help. Like it wasn't for the masses,
Getting
right?
help.
And so again, I was in a
Mm-hmm.
predominantly Caucasian town at the time living, and I kept telling my husband, I said, I feel like something is wrong. I said, I don't feel like it's you. It could be a combination of the two of us, but that female inner knowing and our connection to the divine is something different. And I said, something is not right, and I feel like it is me. I said, I've never been pregnant before in my entire life. Granted, I had been on birth control since I was about 19, 18 and a half, 19, on various types of birth control pills, shots. I've done it all for birth control except for the implanting. I never did that. And so I said, it's been probably 4 years at this point that I had stopped using any form of birth control because right before I met him, I stopped using the shot. I was like, it's time to let that
Mm-hmm.
thing go. I'm just going to monitor my cycle and be more responsible health wise. And I was reading a lot about naturopathy and just learning from my own self knowledge how I could take care of myself better and chart my cycle, which I'd already done, and just learning about the inner workings of the menses and such. And so I said, I'll just keep track of it with my calendar. I'm good. And that's it. And so I got diagnosed at 29. And when I went to the clinic for the first time, and I was barely greeted by the receptionist. She looked at me like, what the hell is she doing here? Why are you here? And
Mm-hmm.
I guess they couldn't tell by my name I was ethnic. I mean, Farouk, come on, that's clearly South Asian or Middle Eastern. And so she didn't greet me well. I sat down, I was filling out my paperwork, and then another woman came in. It was a white woman, and she was greeted with smiles, with care, with concern, and all those things. Her husband came in shortly after her, same thing. They were greeted with smiles, with concern, conversation, and all that. And I was not. And granted, this doesn't make a difference, and it shouldn't, but it wasn't like I went in there looking like I just came from the gym or some hobo or something like that. I came dressed professionally. I looked like I could be there or had, a little bit of money to spend, you know what I mean? And so I go back to the back. One of the nurses greets me. She's also surprised that it's a black woman in the office. Like, have y'all never seen black people before? Like, what is happening? So it was that sort of a thing. The doctor was
Yeah,
nice,
yeah.
but she too was a little taken aback about why I was here. And I could just tell they didn't deal with a lot of black people in this particular clinic. And I chose this clinic for it being a small boutique clinic and not more of a big company like your Shady Grove and such like that. I chose it on purpose because I felt like it would be
Oh,
a more
okay.
personalized care experience and not just another number in the ticket.
Okay.
And so I went through the IUI process with her. She was nice, whatever. Her staff continued to be iffy, was hit and miss of how they greeted me and how I was treated or not talked to or talked to. It was just, I finished my cycle. I did what I had to do. I came to get the diagnosis. I got the diagnosis, and that was the last time I went. I did not go back to another fertility clinic until the spring of 2016. and that was 2012. Yeah, literally years went by. Yeah,
So they did the
that did the
testing, they
histos,
gave you the
the HSG
diagnosis,
test. I had a supposedly
G
had a right
test.
tubal blockage, and there was no issues with my AMH and my egg quality or egg reserve. There was no issues there, and at the time, I hadn't been diagnosed with hypothyroid and hormonal issues, so it was just a block tube, and they went with that. And because I didn't really care for how I was being handled, I didn't care to get any more testing because I probably could have helped my thyroid issues then, but I didn't care to be cared for by them or anybody else for that matter because doctors in America are predominantly white. It's less than 2% of doctors in America that are black. It may be a little bit higher now because a lot of students are going and getting degrees, black doctors and such like that, but it's still under 10, well under 5, percent of doctors in America. So that was that. And so that was my experience with, the microaggressive side of
Mm-hmm.
biases and prejudices and some racism. So, and then I would like pay
Yeah.
for the IUI. Like the first time I had to pay for the testing, I think it was like she wanted the money right away because I was a cash payer and I didn't have medical insurance that would cover IVF or any kind of fertility treatments at the time. So it's a cash payer. Like they were so pressed. Like, ma'am, you have my entire address and phone number. Like it's not that serious. Bill me if you have to. But just small little things like that happened over the course of the
That
month that I worked with them and stuff. And I just, when you know, you freaking know. Like we don't go into spaces all the time
Yeah.
expecting these things. Although we subconsciously expect it, we don't. Like I wasn't going in there expecting this. Like I have something that's going on. I can't get freaking pregnant. I'm expecting a lot more empathy and care, right?
Right.
So that was that. So it's the medical bias is real. Mm-hmm.
It's real. There's a black woman, Harvard researcher, I forget her name, but she actually wrote a book about this and has a lecture on YouTube where she breaks down
Mm-hmm.
the bias, the real medical bias that's very real that we experience. It breaks down
Mm-hmm.
the science of it and everything. And so it's never in our heads.
Mm-hmm.
It's
Mm-hmm.
real,
Mm-hmm.
you know,
Yeah.
it's real. And it's up to doctors to own up to it and say, I'm going to do something about it. But unfortunately, us doctors, we can be
Yeah.
very egotistical. We are very, we're taught to be sort of arrogant
Mm-hmm.
and egotistical. And that is the culture of
Mm-hmm. Mm-hmm.
medicine, unfortunately. And so to have them have to admit that is
Mm-hmm.
there
And to
is
have
a
them
whole
admit that
is
it's
a
toxic. Like, come
whole
on. There's and I think a lot of times, and I understand that concept of teaching medical students to be that way because they want you to be confident in your abilities to care for people, and they want you to be assertive and be able to um, not necessarily take control, but have control of the situation. So I get it, but I think that again, like many things in life, when it depends on the person that's being taught how it will be presented and how it will show up. And yeah,
yeah.
unfortunately, there's a whole lot of work to be done. Yeah.
There's a whole lot of work. While we cannot control outside factors, we can control us. And so that's what the work is focused on, is like, what can we do to clap back?
Mm-hmm.
What can we do to, own our fertility, and what can we do to improve our fertility? Because there is this idea that our
Yeah.
fertility doesn't belong to us, like it belongs to the gynecologist or somebody else, like it
Mm-hmm.
don't belong to us, right? And it starts from very early age. I mean, I remember when I got my period, it was not like a
Mm-mm.
congratulatory sort of experience. It was more
Oh,
like,
yeah.
uh-oh,
Mm-hmm.
oh no. It was like oh no. And then it was like, if you get pregnant when you were a teen, like
Yeah.
it's gonna be a lot of shame. You're gonna bring a lot of shame to the family.
Yeah.
So you bet not. Right? That's what it was. And then that was it. There was no conversation about like fertility preservation, um, how to care for your fertility as you get older, the real effects of like birth control and how it can affect fertility down the road. There's no conversation about that. So the culture is broken and it has failed us as women, right? And so my work is about how do we
And bridge that
reclaim
gap
our
back.
fertility, and so that, yeah, bridge that gap back so that so that we can pass that a new knowledge down the next generation so that they can, own it. And so one thing that I wanted to talk about infertility, one of the reasons why I reached out to you about having this conversation about infertility in me is because I feel like infertility and I have had a fight because I'm like, that I have real qualms about just the term itself, right? And so what I want your readers to understand is that infertility is really just a label. It's not a real diagnosis. Like if you do some research, you'll find that infertility is just really a term that us medical professionals use to communicate to insurance companies that you haven't been able to get pregnant within the 6 to 12 months of trying.
Mm-hmm.
That's all it means. It doesn't mean anything else. It's just a label. It's not a diagnosis, right? And so the reason why I think it's important for women to know that is because a lot of times when women come to me, they're like, they have this identity of like, I'm infertile and can't have babies. And it's like, you're not infertile. You're still having a period, right? You are still making eggs, maybe not regularly and maybe not good quality eggs, but she's still working for you. She's just not at the healthiest state, at the most optimal state, right? And so there are things that we can do to optimize your fertility. And so I find it to be a battle to get women to even believe that there are things that they can do to improve their fertility and to reverse some of the conditions that's getting in the way of their fertility. And so the infertility label really needs a revamp. Like, it's just a label. It's not a diagnosis.
I see what you mean. Yeah, I see what you mean. And you're right. A lot of people don't like to view it that way, especially when they're what I would call newer to the world of fertility and maybe they have just recently got diagnosed. Because I've had the podcast, it'll be 4 years in November, and a lot of the women that I was connected to in the very beginning and them now, some have moved on and had children and some haven't. And over the years I've seen them kind of expand their thinking as they become more educated about fertility issues and are more open to the conversation as opposed to someone who's been more recently diagnosed and or has a more
Diagnosed.
definitive diagnosis of your conditions that we spoke of earlier: endometriosis, fibroids, low MH, all those things that have been more narrowed down through testing, blood work, and all kinds of different approaches to get to the bottom of things. And so I think that it's important for us to remember that two things can be true at once. And so while we have gotten the blanketed diagnosis of infertility and we may want to work with a fertility specialist, we can also work with someone like you who is a doctor of wholeness and wellness from a natural perspective and education. Is very important for that too as well, because there's no point in going through fertility treatments if you choose to go that route if your body is not, or your reproductive, well, no, the body as a whole needs to be an optimal environment for women to bring life into this world and to do so healthily, because when you go through fertility treatments, your baby's more at risk for being born prematurely. I have a preemie son. He was born at 24 weeks, 4 days. So I know what I'm talking about. And y'all know the research is there. Y'all read about it. So, there's all these risk factors that come along with doing fertility treatments as well, which is why I think these two need to be more intertwined together. And the conventional side of fertility health and functional health can really work to your benefit to work
Yeah.
together.
Facts. And I'm so glad you said that because, I call
Yeah,
myself the
I saw it on
middle
your website.
fertility
Yeah.
doctor, right? Because yeah, the middle fertility doctor, because it's kind of like you go to a gynecologist, right? You're like, I've been trying. I need to see a doctor. Usually it's a gynecologist or a primary care doctor. If you go to primary care, they don't
Mm-hmm.
send you to a gynecologist, right? Gynecologist is going to send you to the IVF doc. But I'm like, before you send her to the IVF doctor,
Hmm.
send her to me, because it's a health thing. It's not like a fertility
Okay.
thing. You see what I'm saying? Like, I think the fertility thing gets
Like it's just like
what's the
infertility. We
word?
use it for everything, and it's not more directly
Yeah,
focused on again the root cause or the real root issue of what's happening in the body. Yeah.
correct. It clouds everything. It clouds everything. I was just listening to a one of the top functional fertility docs. Her name is Dr. Jacqueline Chancey. She taught me
Hmm.
in medical school. She said that what they are seeing now, infertility is really the first sign of
Hmm.
chronic
Hmm.
disease.
Hmm.
It's like if someone is having trouble conceiving, it's really a first sign of chronic disease. And so we really need to figure out like how to address the root cause of that chronic disease. It's and not be so quick to label that person as infertile and then move them on to IVF treatment, because then you're missing the chronic disease that's at the bottom of it, right? And for Black women, that's typically the case. There's a whole host of chronic disease that's playing into it, that is reflecting infertility, but it's not. I hope I'm making sense. Like, for instance, like there's a lot of diabetes and high blood pressure in our culture, in our community, right? The way that diabetes can look like infertility is that it stops ovulation from happening, because if you're having blood sugar dysregulation, it's going to mess with
Yeah.
ovulation.
Yeah.
See what I'm saying? If you have high blood pressure, it means you're not getting enough circulation to the ovaries for it to perform at
Hmm.
its
Hmm.
highest. You see what I'm saying? It's like, let's deal with that first before we even push her to IVF. She don't want to go to that clinic.
Hmm. And then
She
I
don't
think it's
want to
important
go.
too with your line of work and other naturopathic specialists is specializing in fertility. I think it's also important to maybe to definitely um, see about working with a specialist like yourself before and or during the process of working with a RE, because like you said, there may be things that you test for that didn't show up with your RE, or because I've seen
It's
it
true.
and I've experienced it. And my diagnosis of having the right tubal
Mm,
blockage, when I went back 4 years later, it was gone. So when I was going to specialists to help with the natural side of things, and what the radiologist ended up telling me, and he confirmed for me, was that there may have been some residual endometrial lining or mucus that got stuck in your tubes, and because they are so small that it had been there a while, and then whatever you have done to optimize your health has gotten rid of it. And so when I went back 4 years later, the blockage was gone. But then I was having issues with hormones, which kind of runs on my mom's side of the family anyway. And so, yeah, duality is a thing, y'all. Two things can be true at the same time. And I think that this is
I like
this is
that.
so important also in relation to what you were just speaking of, Dr. Duga, because fertility treatment is expensive, as y'all know. Y'all know because y'all
Girl,
here.
you got
Fertility treatment is expensive. And although any form of medicine can be expensive, if you are looking to find ways to optimize your fertility and give you a better chance at creating this new life, this may be somewhere you can start before going back to the RE and looking at, again, as Dr. Duga has explained to us, the entirety of our body and its systems and if they're functioning properly, first of all, and if there's anything that we can do before spending 50 grand, okay, on one chance or two chances. I think the functional approach is really, really, really important as well. Really important.
yeah. It'll save you a whole lot of money, a whole lot of heartache and improve your health in ways that IVF doesn't. And I'm not against
Sure.
IVF. I'm for integration. I'm for women
Yeah.
having all the options. And the reason why I speak up is because I know a lot of women are saying,
Yeah.
I want other options, right? And it's like, I'm another option. And the way that I fit into that is I help you get healthy. I help you in that preconception period. I help your ovaries wake up. I help your blood sugars regulate. I help you get out of that chronic stress picture so that things can function as best as it
Yeah.
can
Yeah.
at your age, right? And so I would say there was something that you said and I wanted to piggyback on is um,
Mm-hmm.
the expense of IVF treatment. I don't know if this is how you pronounce her name. She's the black female Ari on
Yeah,
Instagram,
that's how you
Dr.
spell. Yeah, she was on the
Matrika.
show a year ago. Yeah, Matrika.
Is that
That's
how you
correct.
say it?
Yep.
Okay. Dr. Matrika, she posted something about, FSH levels, getting into the nitty gritty of like hormone levels. She talked about like if your FSH levels are
Mm-hmm.
are like 30, then there's there's not medication that she can give you to make the
Mm-hmm.
procedure work for you, right? And when she said that, it was like clear as day, and it was like exactly like this is why I preach the owning your fertility, because what she's essentially is saying is like you as a woman have a responsibility to do the things that you need to do to improve your health so that when you do go to IVF, it
Yeah.
it works better for you. Your chances of success are higher. Like you can't go in with this idea of like the procedures and medications is a magic pill because it's expensive and it's high end.
Mm-hmm.
No, that is not the magic. You, the woman, you are the
Mm-hmm.
magic.
Yeah.
You're the
Mm-hmm.
one making the egg
Yeah. And
for
then if
them
you
to
got pregnant, you will be
use.
nurturing the life in your womb.
You
Yeah. Mm-hmm.
Yes, you're the magic. So this idea that because it's expensive, because it's IVF, that it's going to work. No, you're gonna make it work. It's up to you to make it work. It's up to you to do the work to make it work. So so yeah, I totally agree
Mm-hmm.
with
Mm-hmm.
with everything
And,
that you're
and,
saying.
and for yourself, I know you had mentioned earlier in the episode that dealing with your own emotional outlook and as a woman, because you don't have any children, right? I gathered you didn't. Yeah, so you were saying earlier
Not
with
yet.
even yourself getting
Not yet.
older and helping women who are a similar age group or the ones who are to come after. And so, how has that affected you in your practice and care of clients, and also aging and getting older, and society telling us that we're done. Ovaries is just dust now, right? So that's what they tell us. We just dust. Nothing works anymore.
You just
Yes, if I
it's
had
the
some powdered
blow.
sugar, I'd have blew it out, because that's basically what the medical field, traditional medicine, and society as a whole, and patriarchy and misogyny and all that tells us that we are just dust. We just here to exist after the age of 35, and we get to 40. Don't God forbid you make it to 40. Like, come on.
Girl, I'm gonna be a I'm gonna be a proud geriatric mama, right? Like I'm geriatric at this point, right? So what was the specific question? What do you want me
I'm
to
sorry.
specifically
How do
answer?
you, in your own personal life, overcome the emotions of aging and wanting to be a mom?
hmm hmm I That's such a great question because even though like I know all of these things, I have all the tools, I have all the knowledge, it's still something that I think about, right? Because
Mm-hmm.
it's very real, right? The way that I deal with it is I do my best to take care of myself. I like before fertility, like I was the woman who would run her body to the ground working. Just lack of, I'm used to the lack of sleep from being in medical school, going through school, and lack of sleep, skipping meals, not working out, those things used to be like optional. Those are non-negotiables for me now, because the research is so clear that those are the things that we older women need to do in order to preserve our fertility as we get older. And to me, it goes beyond being able to get pregnant. I think about the health of my children and the health of my grandchildren, because with the science of epigenetics, I don't know if you talked about this on your show, but epigenetics is like the new school of thought. So, when we were growing up, we were taught that genes determine everything, and that's it. There's nothing you can do about it. So when you hear the whole 35 is the cutoff age, like there's nothing you could do to improve your health to improve your fertility as you get older, that's debunked. Like, that's old fable at this point, because the new research is showing that genes don't determine everything. Environment determines things. So I do everything that I can do in my environment to make sure that the expression of my fertility is at its highest potential, and it's going to take me well into my 50s. That's how I think about it. It's like, I have the power to control how fast my biological clock is moving. If it's moving really fast, I know what to do to slow it down and to elongate it, because fertility is not this binary fixed, you're either fertile or infertile, hyperfertile or subfertile. It's something that is very flexible, and it could be changed and shaped and modified, and you modify it through your lifestyle, right? So in my clinic, I call it the 4M framework. You modify it through mindset, movement, meals, and metabolics. Mindset is the mindset that we need to have, is that our bodies as women is more stress sensitive than men's bodies. Why? Because we are the reproductive gender. We carry the babies. And so our bodies need to be super clear about whether it's safe to have a baby or not. And so we're going to respond to stress differently than our male counterparts. That's the first mindset you need to have. So you can't be out here, moving through the world like you're not a woman. You are a woman, a female body. Your system is more sensitive to stress. So if it feels like it's under too much stress, it's going to shut down the baby making department. Okay. So relaxation is key. Stress management is key. 2 is movement. Walking is actually better at reducing stress and better at boosting fertility than exercise, because the way that we do exercise, it actually stresses our fertility system. Why? Because we've been taught to exercise like men. We live in a patriarchal society. We have to keep coming back to that. Nothing is created for your female body. Everything is created for the male body. And they condition us to be
males in a lot of the things that we do when we weren't set up to be that way. By Mother Nature. We are divinely connected to Mother Nature in a way that men are not. So
Exactly. So the mindset is like, being a woman means my body's more stress sensitive. I need to stop acting like I'm not a woman. Right? And then, so movement, and then meals, incorporating meals that help your detoxification system, because we're surrounded with toxins. Meals that don't further stress your fertility, that don't add inflammation to your fertility. So when you talked about the blocked tubes and then it going away, I thought about that probably was a lot of inflammation, and whatever you did decreased the inflammation and opened up that tube, right? That's very powerful. I wanted to ask you more about that, but I know we ain't got no time. And then the next one is metabolics, is those are your supplements, your botanicals, all of those things. But the stuff before that has to happen in order for your botanicals and your supplements to work the way that they need to. What I notice is that people, right. Exactly. A lot of people jump to the teas and the supplements without doing the other stuff that I just told you about. And you're like, it's not working. It's not working because you didn't do the other lifestyle stuff. Right. So what I want your listeners to walk away with, fertility treatment is not just about the procedural drug stuff. Fertility treatment is supported by a fertility focused lifestyle. That is what's going to increase your chances of getting pregnant. There's no substitution. There's no way out of it. I'm sorry, Mother Nature made it that way. You got to do the work.
Yeah. And I think that ties into, again, a lot of the conditions that our friends listening or watching today are already dealing with. We're dealing with not only fertility issues, but another root cause of that is mental health. like you stated, when you focus on the mindset in your program. People have diagnoses and are on medications prior to even getting connected with an RE. And I just talked about this on my last solo episode about how, everything that we're doing in life is not setting us up for um, for successful cycles or whatever the case may be, because we're working like crazy out here being worker bees, right? Chasing the patriarchal dollar. Then we are exercising too much a lot of times when we're trying to conceive. I had to learn it the hard way. And then, like you said, we are not detoxing our mind, body, and spirit. All of that stuff works together, y'all. All of it works together. Trauma. I mean,
It
I went to see a
does.
Reiki specialist during that 4 year period. I did it all. There's nothing I didn't do. I did it all because
Oh,
all of it matters. Because what
yep.
happens when you do get the baby? You have a life that you have to take care of. You have a life that you have to impart wisdom and all those other things into. So I can go on a tangent, but your third your third M. We
Girl,
got we
I
got our
got
we got
good too.
our mindset. Of course, we know that is a very important mindset. So a lot of you guys are already working with mental health specialists, which is fantastic. Then you said meals for optimizing detoxification naturally to optimize our body, right? And then what was your third M?
So the mindset is at the
Mm-hmm.
base. Then it's
Oh yeah.
movement is right above the mindset, and then the meals, and then the metabolics, which is like the botanicals, the herbs, and the exercise. Right? It's not that exercise is bad. It's just how we're exercising, and over exercising is really counterproductive to fertility. So I teach women how to incorporate exercises that actually boost
So a
fertility
lot of
and
that
not
is it low
block it.
impact. I remember doing a lot of low impact exercising, or is it weight training?
Actually, 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 it's more like a think high
Okay.
intensity interval training, but
Mm-hmm.
but shorter, like
Okay.
within 15 minutes. But the focus is not to just get breathless, but to actually burn. You want to feel the burn, because what the research is showing is that when you are exercising and you do a workout that is you feel the burn, it increases
Mm-hmm. Mm-hmm.
HGH, human growth hormone. And human growth hormone is what you want in order to have your
Mm-hmm.
ovaries make good quality eggs, right? You know this from probably going through the whole, journey, like HGH and all of the hormones. So your body naturally makes HGH. And so I focus on exercise routines that help women make
Gotcha.
more HGH naturally in the first
Gotcha.
half of their
Okay, so you
cycle.
align
Yeah.
everything with the menses then too as well, as part of treatment, which is really important. Yeah, yeah,
Yeah.
makes total sense.
Oh yeah, that is the piece. That is the piece that I haven't got into yet. So, make when a fertility focused lifestyle is also really knowing where you are in your cycle and adjusting your meals, your exercises to the different phases of your cycle, because that is what's really going to optimize everything. Like that requires a
Mm-hmm.
whole nother episode, but that is, to me, what I'm noticing is like the
Mm,
magic. Like when I first learned this and I started incorporating it in my lifestyle, like
mm-hmm.
doing the cycle syncing,
Game changer.
my
Mm-hmm.
menstrual cycle looked beautiful. Like ovulation was beautiful, cervical mucus was beautiful, the luteal phase was beautiful. I was like all in one cycle. And this is the thing, it doesn't take very long. Once you know what your body needs and you do it and you commit to it, it doesn't take very long for your fertility to restore itself. It's just that we have to get out of our
Mm-hmm.
own way and actually do it and
Mm-hmm.
actually listen to our
Mm-hmm.
bodies.
Yeah, I love that, Doctor Duga. What would be a word you would give to us today to help encourage us as we move forward in whatever path we decide to take to family build? Just a
Like one
phrase, a
word or
sentence, or
like
I mean, a word as in a word of
oh,
encouragement. Yes, I'm
okay, like a
sorry.
word. Okay. I know. I was like, wait, there's two ways I could look at this.
Yeah, I'm
Bible said
sorry.
word is
Yeah, I
the whole
forgot.
sentence.
Yes. Oh my
Um,
gosh. Yes.
um, it is not your fault. It's not your fault. society, culture is broken, has not served us. And what you're dealing with is a mismatch between reproductive biology and modern lifestyle. They just don't go together. So that is what's happening. So it's not your fault. You are not broken.
Love that. I think I needed that reminded my dad myself. Okay, listen, because this patriarchal world we live in will have you thinking that you are crazy. I feel like, especially for us women, again, because it wasn't created for
Mm-hmm.
us to move in our power. But that's a whole other
It
topic
wasn't.
for a different
It
show. Okay,
wasn't.
listen.
That's perfect. Oh my gosh, this was such a good conversation. The alignment, we share a
Yes,
lot of
ma'am.
values. And so I really appreciate your perspective, like the deeper spirituality piece, which is where my passion lies. I
Mm-hmm.
know we didn't talk a lot about that. But the spirituality piece is huge. And when I hear you speak, I'm like, she gets it. She gets it. We're not talking about it fully, but she gets it. And I'm
So
so
I'm just so
happy
glad
that
that
you
we
get
were
it,
able to have this
you know?
conversation today. And I think that moving forward, it will be extremely helpful and valuable because we are looking for alternative ways to get back to who we are. And
Mm,
and I love my specialists that I have worked with in the
mm.
past to have my sunshine. But again, duality is a thing, y'all. And we can go to these clinics and we can get on that IVF train, but having a full spectrum of what health is and what I'm gathering from Dr. Duga today is having the full spectrum, having the full picture of it all. And then that way you can make a more educated, logical, and not so emotional decision for your path to family building. Yeah. Yeah.
Ooh, girl, you be hitting the points. You be hitting the points. Because right before I got in this call, I was thinking like of things, and I said, we are making emotional decisions on a journey that requires us to make more rational decisions, right? And I feel like that's the missing piece. A lot of women are like, it's just not God's timing. Or, they're stuck in
Shame and
shame. A
guilt.
lot of it is
Yeah.
like emotion is like the shame, guilt, fear. And it's like, but let's
Mm-hmm.
focus on the data. Let's focus on the strategies that have been shown to help a woman like you. Let's focus on that and move towards a different uh,
Mm-hmm. Mm-hmm.
feeling
Mm-hmm.
towards it. So thank you for saying that. Another word, I know we're wrapping this up, that came up is I actually believe that the when women enter that
Mm-hmm.
that the fertility journey where it's like difficult for them to get pregnant, I think it's necessary. I think it's a necessary journey because what I'm finding is the journey comes to teach you that there are certain beliefs and biases and
Mm-hmm.
behaviors that you need to let go of as you're entering while you're trying to enter motherhood. The second piece I'm noticing is that the journey is coming to teach you that you need to learn more about who
Mm-hmm.
you are as a woman. And you need to learn more about your female body. How long has it been? The fact that we don't know how our menstrual cycles
And
work
the
as
fact that we
grown
no
ass
longer
women
celebrate, and
says
the
a
fact that we
lot.
no longer celebrate the rite of passage of acquiring and gaining our menses as adolescents. And that's what I mean by getting back to who we are, because that used to be a rite of passage for young girls. There would be ceremonies, just like there are for boys,
Exactly.
when they come of age, rite of passage, or they have been left intact, and there's rituals for circumcision ceremony. Like there used to be things like that for women, and as a society, we definitely have to educate ourselves, educate the men too, because there's a whole lot of men who know but don't know, and unfortunately, doctors don't help because they look at it from a different perspective and not for the beauty that it is. And so, um, if you're listening and you've been feeling a lot of shame around your menses and you don't understand it, or you had bad experiences in the past and your parents were the kind that didn't talk about these things, glad you're here, because today we're going to end that, and we have to definitely let go of the shame of being women. Like, We bring life into the world.
Yeah.
They call
Yeah.
us woman for a
We
reason,
bring life into the
WOMB for a
world.
reason, okay?
Yes. Yes. Yeah. This journey is here to change us and to transform us so that we can step into motherhood
You're
in
gonna
our
need
full
it.
power. And so
You're gonna need it
that's
when
what
you
I'll
have these
end with.
babies, okay? You're gonna need it because you won't just have yourself to take care
You're gonna
of.
need it.
You'll be responsible for another soul
Exactly.
on this side. So, however that happens
Exactly.
for you. And Dr. Duga, where can we find you
Mm-hmm.
online and also your website as well?
Yes. So you can find me at shedoesmedicine.com. If you want to just learn more, dive more into my work, while also gaining more clarity about your own fertility and what makes it unique and how to personalize your fertility game plan, you can go to shedoesmedicine.com/quiz. Take the fertility body type quiz, which is a tool that I created to help women gain clarity on the fertility journey, because that's the first step to winning this game, to winning this journey, is to gain clarity of where your hormones are, what's actually happening, what's at the root, and then develop a plan from there. So go to shedoesmedicine.com/quiz. If you're like, nah, I don't want to do the quiz, I just want to learn, just want to talk directly with you, then you can email me at dr.k.duga
And all of Dr. Duga's
shedoesmedicine.com.
information will be in the show details, so you can tap and go and connect with her directly from this episode, whether you're watching on YouTube and or listening on your favorite audio platform. Again, this was such a pleasure, Dr. Duga, and I'm so glad we had the opportunity to connect in this way. And my son is calling me, so I gotta go, y'all. Okay, it is time.
It's
I got to get back to my motherly duties, y'all.
time.
We appreciate you for tuning in to another episode of Infertility and Me Podcast. You guys know where to find me on the gram, Infertility and Me Podcast, on YouTube at Infertility and Me Podcast. I appreciate you guys. Peace and blessings.